Brian Druker, the director of the Knight Cancer Institute at Oregon Health and Science University, is one of this year's Tangprize recipients for biopharmaceutical science. He's being honored for his work leading to successful targeted cancer therapies.
Absolutely remarkable to hear that I had won this award. I've known about this award through one of my advisors on our cancer center, and I've done a fair bit of research and understanding how important this award is, and it was absolutely remarkable to receive a phone call with this incredible news.
One of the main motivations for Mr. Druker's dedication to targeted therapy research was a young pregnant woman he met with chronic myeloid leukemia. At the time, chemotherapy was the only available option, and during treatment she passed away due to a urine infection, leaving behind her husband and newborn baby. It was a sobering moment that increased Mr. Druker's determination to be involved in finding treatments for cancer. Within the last 20 years, he has revolutionized the field through research that resulted in the first drug, Gleevec, to target the molecular defect of a cancer while leaving healthy cells unharmed.
We're trying to understand what drives the growth of cancer and use that knowledge to attack cancer without harming normal cells. Now, 20 or 25 years ago, that was considered impossible. But we worked on this disease called chronic myeloid leukemia, or CML, where we understood exactly what drove the growth of this cancer. And working with a drug company, we helped to design a drug.
Mr. Druker says the biggest difference between targeted therapy and traditional therapy is its effectiveness in attacking cancerous cells and at the same time not harming healthy cells. The reoccurrence of cancer cells has also been found to be relatively lower in targeted therapy. Currently, Gleevec is being used to treat over 10 types of cancers. A cancer patient who had been told she only had 6 months to live agreed to participate in the clinical trial of the drug. She has survived to this day, 19 years later.
Oftentimes at the end of a long week or a hard day or frustrations that I'm having, and I'm feeling a little down on what I'm able to do, out of the blue I'll get an email from a patient who's on Gleevec thanking me. And it reminds me of why it's so important, the work that we're doing. Because they're alive because of the work we've done. And they're a living reminder of the power of what we can accomplish.
Mr. Druker has worked tirelessly so that more cancer patients can overcome the disease, offering hope for all cancer sufferers.